The demand for physical therapists is expected to increase 27% in 8 years. With this profession growing faster than average nationwide, we interviewed physical therapist Sue Potts of St. Jude Medical Center in Fullerton to learn how the rapid changes in physical therapy are improving the lives of those recovering from serious surgeries, injuries, and diseases.
I work for the Department of Rehabilitation at the St. Jude Centers for Rehab and Wellness. My specific area is the Center for Neuro Recovery, so it's actually the Neuro Rehab Center. I've been involved with this population for the past 30 years, and it's really been in the last 10 that research has really shown that there is neuroplasticity. There is reorganization within the brain and the spinal cord, that recovery is possible. And for me, that's totally exciting. 30 years ago, we just taught compensatory skills for what the disability was. Now we're really looking to improve the function of the person and get them to the highest potential they can be. And that's possible now because of the research and the information that we've gotten back in recent years. I think compensatory skills to learn to deal with the disability are absolutely necessary in some cases. The more you can use that affected arm, the more the brain reorganizes itself to have an area that moves that arm that maybe wasn't impacted by the stroke. What we want to do is encourage use of the affected side as much as possible. And by doing that, we're seeing much better motor return in the arm and in the leg in our stroke patients.
What is unique about physical therapy treatment today?
Years ago, with therapy, you'd go into your rehab center, your inpatient stay, you'd go to your outpatient stay, and then you were done. And that isn't the way that we treat any longer. We might start with inpatient and outpatient therapy, but a person might be discharged, get some amount of return, and then come back into therapies to work on those spontaneous improvements that occur so that we can maximize whatever the functional use that spontaneous recovery enabled us to have. So that's a good thing too. I think also, where you're saying the technology has changed, you're seeing a lot more use of robotic therapy now than you were 50 years ago, 5 years ago. I mean, that's the difference. And again, it's just that forced use of those extremities to really reorganize the brain into saying we can still manage these movements, even though this isn't the area of the brain that used to be responsible for that kind of movement. Robotic therapy does open up avenues of recovery that weren't available previously, but it will always come down to the therapist evaluating the patient letting the therapist know what the goals are, and those two working together to establish a treatment program that meets that patient's goals. I'm going to call this patient Jim. He was an Olympic weight trainer that was taking steroids and had a massive stroke. And when he came to us, he was fairly comatose and non-responsive. And we worked with him for several weeks without seeing any change in his status whatsoever, enough to the point that we thought we were going to need to discharge him from the inpatient program to a lower level of care. And all of a sudden, he started waking up a little bit. And as time went on, his level of alertness improved dramatically to the point that he did get better enough to go home and come to the outpatient program where he continued to work on all of his areas of limitations. And today, he's a father of 2, he's holding down a full-time job. He still has some disability. His speech isn't always that clear, and he still walks with a limp. But as far as being out in the real world and having a good quality of life, he definitely achieved that. And those are stories that it's hard just to pick one because it happens to multiple patients. And recovery doesn't mean 100% return to normal, but it's getting back into a life that you feel has value. And that can occur whether you're sitting in a chair or you're skipping down the street.